Zeus was brought down to us because he was racing around the track, he slipped, and they think he may have broken his leg.
So one of the nurses there has been able to wrap it up for us.
She did a pretty good job. Luckily, there were some vet nurses there that were able to stabilise his fracture with a splint.
Just worried because he was going into a bit of shock.
Get some pain relief for him, we'll make him feel more comfortable. Hey Zeus, it's okay, mate. Good boy. That must have really hurt. It must have been hooning down around the track. These guys run so fast.
Good boy.
Owners Christina and Howard have had the rescue greyhound for just 1 week.
Zeus is the most docile, friendly, beautiful nature dog. He's a dream dog. He loves to run, but then on a corner, he fell and, well, was hanging, so.
He seems okay, his back legs. Just gonna check his other front leg. That's right, that pain relief will be kicking in soon, mate. You'll feel a lot better soon.
Zeus needs urgent x-rays.
Greyhounds are pretty robust creatures. They're designed to run fast, but when something goes wrong, when they fall over, they hit at high impact, so things can be disastrous. One of my biggest concerns is he may have shattered that bone beyond repair. Can't imagine how fast you may be running.
We'll see you at 5:30. No worries, babe.
In Melbourne, Danni has a busy lineup of patients.
Hi, baby. Hey. You okay?
Steph has just arrived with 11-year-old Marley after a suspected accident at home.
Hi, Steph. How you going?
Good, how are you?
Good. What brings Marley in today?
So we've just noticed that she's cut open her little paw
Oh, darling girl.
and it seems like the pad has come out.
Oh, no, darling. Did you see anything happen? Any trauma? Or
No, nothing at
sure?
all. Just
No.
came home and that's how it was.
Has she been using the paw at all?
A little bit, not too much.
Okay. And has she been well otherwise? Haven't had any other concerns with her lately?
No, she's been absolutely perfect.
Okay, well that's good. I'll take her through and then I'll come and have a chat to you in a minute, okay?
worries.
Won't be too long. Come on, Marley. Come on. You're gorgeous. Oh, yes, it's looking a little bit dirty there, darling, hey? Oh, sweet pea. Let's have a little look there. Sorry, darling. Oh, ouch. Yes. Oh, that looks very ouchy, mate. It's strange, the paw pad feels really squishy and the tissue looks like it's split and then it's herniating out of that. It's just not looking healthy at all. And it does, I just want to have a look at the other paw pads and see if there's anything. Yes. Marley's come in today with a lacerated paw pad, but I'm having a look at the paw pads. They are all abnormal. They've all got this compressive tissue that's all squashy. So I think we've got something else going on here. So I think she's got a condition called pillowfoot, which is a plasma cell pododermatitis. So if you can see the actual paw pad is really abnormal. It's just squashing under my finger. It's not a nice, firm, sort of dense structure anymore. So I think that's then led to the laceration. And now it's just how we manage that. I'm not loving how well that's going to heal. Poor Steph, this is going to be quite a bit of information overload and a shock because Marley's come in with what looks like just a simple laceration, but it looks like there's also some more serious conditions going on here, possibly feline AIDS as well, so it's a lot to take in. I don't like the chances of it healing without surgical intervention. Oh, Marley, darling, I'm sorry.
Oh,
Is he just
wow,
there?
oh
Just
my.
there, just there.
He's up and
Here, and he got up again. That's when I got a shock and dropped the camera.
Oh, he fully rolled, didn't he?
A trip to the park has ended in a dash to emergency for the devastated owners of 2-year-old greyhound Zeus.
The next step is obviously we would take him to x-rays. The big unknown is how severe the fracture is. So
That's understandable.
yeah.
Gerardo's worried the young dog may have shattered his front leg beyond repair.
Hello. Zeus, oh, he's the most friendly, beautiful nature dog.
He looks really comfy now, doesn't he?
Yeah.
What we're going to do now is place an IV catheter, start him on some fluids, then we're going to do an anaesthetic and take him to x-rays. Good boy.
Best patient ever.
Yes, he's been a very good boy. He's been moved.
No, he hasn't.
The most important thing we need to determine is how bad that fracture really is. It's time to find out what happened, hey? The worst case scenario is the fracture is in multiple pieces and it could be too difficult to repair. Okay, well, they did a good job.
Quick-thinking nurses at the park were able to apply a makeshift splint to Zeus's leg.
What do you think that is?
It's just a pen.
That's a pen. So what they did is they used 2 pens and it's formed a splint on either side of the fracture. That was really good thinking because that makes him feel a lot more comfortable almost immediately. How's it going? Is he okay?
Yeah, he's nice and stable.
Nice and stable, because once we take this off, he might experience some pain. Oh no. That is definitely broken. He's just removed the bandages and immediately I can tell it's completely fractured. He's broken both bones and his lower forelimb there straight in 2. Well, let's take an x-ray and have a look and see, hey? The other thing I'm concerned about is that I can see there's bleeding there, which means that there actually may be bone that has penetrated through to the skin to the outside. That is a big infection risk. X-ray.
Inch.
This must have been incredibly painful for Zeus. Oh.
Wow.
Yeah. This is not so good for Zeus.
I think.
Danni is starting to suspect Marley's lacerated paw could be due to an immune condition linked to feline AIDS.
They may need to remove that paw pad.
She needs more information from Marley's worried owner, Steph.
Hello, so I'm just having a little look at Marley. I was wondering, has Marley ever been tested for FIV before? Okay.
FIV, or feline immunodeficiency virus, severely affects a cat's immune system, reducing their ability to fight off infections, as well as increasing their risk of developing certain cancers.
Well, I might do that test today if that is okay with you.
Yeah.
Just want to get the full picture as to what's going on.
Yeah.
Okay, I'll get that done now.
No
Okay,
worries.
won't be long.
So I've come in with just a cut open paw, and to hear that it could be a rare disease is really, really scary.
I'm sorry. Very brave, very brave. Okay. What a brave girl, sweetie, hey? Well done. So we're just running an in-house test to see whether Marley carries FIV or FELV, which are viruses that affect the immune system of cats, and it can complicate healing and infections and things like that. So we want to make sure that that's not present. So we've got 2 red lines. That means we are FIV positive, and that was what I was really worried about. That's not great news. So even though FIV is not a condition that's contagious to humans, it is easily transmitted to other cats through scratches and bites. So it's important that Marley's kept indoors, away from other cats, to avoid spreading that disease any further. Oh, what a brave girl, what a brave girl. I'm really concerned that because Marley is positive for FIV virus, we've got a condition in the paw pads. This laceration is not going to heal well. So we're just going to pop a bandage on to protect that wound there until we can get into surgery. So at this stage for Marley, I think worst case scenario is that she may need to have her paw pad removed surgically. So I'm really unhappy with how this paw is looking. So we're just making Marley as comfortable as we can today, but she's going to have to come back for surgery. Alrighty, darling, we've done what we can for you today. All right, sweet. You want to go back into your little home? You'll be in good hands, you will. Hey, you've got a mummy that loves you very much. It's just thrown me today because It should have been a really simple treatment, and it's just so heartbreaking seeing such a beautiful cat with this owner that loves her so much. I have so much going on. Oh, darling, you've got a bit of a battle ahead of you, sweetheart. It's not fair.
Tim,
Go ahead, Kel.
do you like to come down, meet me at the Devil enclosure?
I'll be there in 30 seconds.
As well as running the reptile park, Tim's other passion is Aussie Ark, devoted to helping save the Tasmanian devil from extinction.
Here's your mum.
Today, Kate is visiting for some important health checks.
The Ark is a sanctuary for native animals. There's a whole lot of protected species at this one place, and it really is a magical place.
Welcome to the Ark.
Hello Tim, how are you?
I'm good, thanks. How's the drive?
Oh gosh, it's so beautiful,
Beautiful?
up here.
Yeah. We've got a busy day for you.
We all start being a vet because we love animals so much and all we want to do is help. Wow, look at this. Hello there, little guy.
Polly and Edward.
You have names for all of them.
All 200.
Do you really?
Yep. Yep.
Along with Tassie devils, the Ark is also home to a number of other endangered Australian animals.
So this is our native wildlife conservation facility, and there's a couple of thousand of Australia's most endangered mammals right there. I've asked Dr Kate to join me at Aussie Ark for the day to administer treatment to a range of animals that have got injuries. Will we put you to work?
Yeah.
Watch the puddle.
What have you got for me?
Head over to quolls. Quolls are carnivorous marsupials, and there are 4 species of quoll in Australia. Every single one is endangered. So we've got 3 in here. We've got Quolline, Lars and Tim. And the one we're after is Tim. He's named after me. He's 4 years old. He's outlived life expectancy by about 1.5 years. We're a little worried about him because he's been observed to have an abnormality down near his bottom and just showing signs of old age. There's your tool for today.
Yep, great.
You won't be able to swat it like a butterfly. You'll have to let it run into the net. Okay, let's search.
These guys are super quick. Oh, and they're a little bit aggro. So we need to be a bit careful about how we do this.
We've got one under here.
Oh man, this is harder than it looks. These quolls are fast.
Oh, there he goes.
They are everywhere. Up the tree, down the tree, in the log, like it's all over the place. They're absolutely crazy.
Where'd he go?
Oh, this is hard, Tim.
Yeah, it's tricky. It's tricky. It's impossible to get your hand down and try and grab their tail. So we put a net at each end of the log that they're under and give the log a bit of a tap and hope that they fire out into your nets.
Oh, got it.
Turn it over, turn it over. That's it, you got it. And I've got the other one, 2 in 1.
There's one very angry quoll in this little bag. So Tim, in the grand scheme of quoll life, is very old.
Oh, he's 100-year-old if you wanted to compare it to us. That's right.
Yep.
Yep, light brown.
Yep.
He's a big fella too.
Hey, buddy.
Just having quite...
Holy teeth.
Look at the teeth.
Yeah, I know, right? Tim is a really old quoll. He's well past his life expectancy date and he's got a little mass that Tim wants me to have a look at. I mean, just looking at this, and obviously without a biopsy, you can't actually tell whether this is a real tumour, right, a malignant tumour, or whether it's just a benign fatty tumour. But the reality is, in order to take a biopsy, you may as well take the darn thing off. It's quite a big surgery for an old quoll, right?
I don't think you'd make that.
I mean, I think that it's very stressful for an old quoll, right? And once he gets to a point that we feel as though you feel like his quality of life is suffering, and I think then that's the time to make some decisions.
Yeah. The plan with Tim is to ride it out, let him enjoy his old days without surgery and stitches and complications and unnecessary pain. Okay, mate. Well, you can go back in your box. We'll see you another day.
Next for Kate to check out is another quoll called Quolline. But will Kate be able to deliver the good news Tim is hoping for?
Now, let's just go and have a look at this pouch.
Right, just...
Oh, God!
Alrighty, let's go.
Today, Alison and Audrey are swapping their mobile vet clinic for a Sydney rehabilitation centre. And a very brave boy called Chaz is on his way in with owner Anita.
Chaz is a blue heeler who 3.5 weeks ago was in a horrible accident where he was hit with a motorcycle. Hi Anita, how are you?
Hi, Chaz.
Hi Chaz. Oh, so nice to see you again.
Chaz is part of the family and obviously, you know, it's been very stressful. Yeah, it upsets us, to see Chaz like this. I looked out the window and saw him trying to run. He was on his front legs, but his torso was dragging and his legs were behind.
1-year-old Chaz underwent major spinal surgery, but still hasn't fully regained use of his back legs.
Obviously not being able to use those back legs is a learning process for both you and him.
Yeah.
And the fact that he hasn't got any deep pain, so that's feeling on the back legs, is a concern for long-term management.
Yeah.
The twins have started Chaz on an extensive rehab program to hopefully get him back using all 4 legs.
Let's just test the deep pain first, because that's something that he had initially that's now gone, and that's quite an important test. You
can definitely feel that because he's tugging his back leg back.
So deep pain is when we're using my nail to press between the toes, and that creates a pain sensation. So we want to see if he can feel that and also react to it, so pull the foot away. And he's doing that today, so that's a really great sign.
Better than what we were expecting.
So now we'll do a patella reflex where we essentially use a hammer to press on the patella tendon or hit the patella tendon right there. I'm hitting quite firmly, and what I want to see is that his whole foot moves or it jerks in response to that. That's a really nice one. We just need to do the other side.
So I might just flick you over, Bubba.
Ooh. He has an amazing knee jerk reflex on both legs, so again, another promising sign.
The girls are also using acupuncture to help Chaz recover.
Okay, I'm gonna just put a point in the middle of the head between the eyebrows. I put one needle in the middle of his head, which is actually the calming point. I do this with all my acupuncture patients because it really calms them down, and often they'll fall asleep during the session, which is great. So the hope for these sort of treatments is that we get some feeling or as much function back on the back legs as we can. We know he's been up and down with his recovery. We started off with no pain in the back legs to now we've actually got some sensation back, which is really, really good.
Today, the girls are particularly excited for Chaz, with something extra special planned.
You're gonna love this, Chaz. I can't wait, it's so exciting.
That confirms that, 100%.
At the emergency hospital, it's not good news for Greyhound Zeus.
Completely fractured through lower forelimb.
X-rays have confirmed Gerardo's worst fears.
We got some more X-rays and things just look worse. This is his right leg, this is his normal leg, and this is his left. And that's even possibly a piece of bone sticking out through the skin. This is a serious fracture.
The young greyhound is going to need immediate surgery with an orthopaedic specialist.
My job today is to stabilise Zeus, keep him comfortable, clean out the wound, and then get him prepared and ready for specialist surgery, because this is a fracture that I don't want to touch. I'm hoping that there's no bone poking through. Oh no, that is his bone. Now that we know it's an open fracture, our biggest concern is infection. So we're going to flush the area and start him on some IV antibiotics. Anyway, we can change the gloves and then we'll do the final flush in there, hey? So what we're doing now is flushing the inside of the hole where the bone is, because there's exposed bone there now. The flush is really important because if we can get rid of any debris that's in there, then that will reduce the risk of infection occurring later. Bones do not like infection. Let's wrap him up, hey? Here we go, see if we can get this rolling. So what we're doing now is replacing a Robert Jones bandage. So it's a real thick layer of cotton, and then we'll compress this cotton down and it'll form a nice compressive bandage that will keep swelling down and stabilise the fracture at the same time. Sound like a watermelon?
Yeah, it does, yeah.
We know when it's right when we can flick it and it sounds like a watermelon. It means that the pressure is enough. It's been a rough day for Zeus. He's got a significant fracture. It's going to cause him a lot of pain. My hope is that they can fix it. We've done everything we can for Zeus. Now it's time for the surgeons to work their miracles. You rest up, mate.
It's an extra special day for Alison and Audrey's patient Chaz. The brave one-year-old lost the use of his back legs after being hit by a motorcycle.
Now we're going to see Reese from the animal rehab clinic, and we're all excited because we're going to fit Chaz with a new wheelchair. So we've got to measure him up and see how we go.
We're just going to get 2 measurements which will help us find the right size for him. Firstly, we'll just get his leg height there, and we'll just get the length of his body just to his armpit. If we come back in a couple of days' time, we'll have the right wheelchair for him.
That's exciting. So maybe we'll give you some hydrotherapy now, see how you go. Good
Ooh,
boy.
This is new and exciting.
Good boy. We'll walk him into the unit, fill the water up to about hip height. That will just give him some extra buoyancy so that we can teach him how to walk and help him place his feet.
So who's getting in the water?
You're getting in the water today, and I've got some exciting attire for you.
Okay.
You're gonna put this sexy number on.
Oh wow, I've always wanted to wear one of those actually. They're a little bit big, but they'll do.
That's a good boy.
So I'm just moving that back legs because what the water is doing is giving him some proprioceptive and sensory feedback so that he's getting used to that walking gait again.
Oh, good boy. What is it?
He starts moving his front legs while I'm moving his back legs and supporting him. And that's quite exciting because for him, he's feeling that movement again, which he hasn't done for a few weeks.
You did really well today, Chaz, and we'll see you again soon for your wheelchair. That's exciting.
Now, let's just go and have a look at this pouch.
At Aussie Ark, Kate is helping Tim with some of the precious endangered animals he's working to save from extinction.
Wow, look at this.
You see it already?
Yeah. So you can see down in here, you guys, what have we got?
Wow, look at that. Quolls only live for 2 or 3 years. If you don't breed for 2 years, you've lost your whole population. So every year at this time of year, our fingers are crossed, hoping to see those joeys.
A little joey.
Can you count them?
1, 2, 3, 4, 5, 6 of them, Kel.
And it is a full pouch. 6 tiny little, still kind of pink, a little bit dotted, ears folded down, eyes covered with skin. Beautiful quoll joeys.
And you can see this little face here, little ear.
Oh, there's an eye, a dark eye.
A little dark eye. This is a really special moment. These guys have been waiting all year for this moment, and they are so excited. I'm so excited.
They're all in great health.
They're in really good health. Well done, Mum.
The babies will stay in the mother's pouch for around 3 months.
The bit I always look forward to is heading off to the Devil compound.
Now, this is our enclosure. There's 10 males in there.
Yep.
They're all 3 to 4 year old, and it's Moose that we're concerned about. Moose is a 3.5-year-old male devil, and he's in an enclosure with 10 other males. He's lost condition, he's being bullied, he's super aggressive because he's overcompensating.
He's really angry.
And this morning, we found that he has a laceration on his tail. Yeah. So we're not sure if there's something underlying
Yeah.
or if he's just being bullied.
Hi, guys. How are you all? There is no way we are going to be able to catch moose without a strategy.
See that stake over there? That's what it's got to go on to.
Okay, we've all got our jobs. Tim is behind, he's going to be the catcher, and I'm going to get all of these devils to attach to this bit of meat.
So you need to show them this
Yep.
rather than your leg.
Okay, sure.
That's the idea.
It can't be that hard.
Keep going. Keep going. You got to hold it out. Hold it out. Hold it out. Hold it out. Hold it out.
I'm holding.
Hold it out.
Good girl, Marley. We need to see how your paw's going, miss. Yeah.
In Melbourne, It's been 2 weeks since Danni diagnosed FIV, or feline AIDS, in Steph's beloved cat Marley.
I think you've got a bit of a battle ahead of you, sweetheart. It's not fair.
Badly lacerated paws were the first sign that something was seriously wrong.
Oh, that looks very ouchy, mate.
The little cat had to undergo surgery to help her paws repair.
I thought she'd just cut her paw open. I didn't know it was this big. I didn't know she had such a rare disease.
Hey Steph, how you going?
Not too bad.
How's Marley?
She's doing so well.
Oh, wonderful. I'm so excited to see how that paw's looking today. Hey? You want to come with me? Yes, you said yes. Let's see how your paw's going, miss. Hey? It's been a big couple of weeks for Marley. The first time I saw her, that paw was looking terrible from that laceration. Darling, all right, let's have a little look at you. Oh, so that is healing beautifully. It's not perfect. We have just that very superficial layer there has broken down a little bit, but all the deeper tissue has healed beautifully. I am so happy.
You've done so great, Marley.
Hey? So this is a really good result, considering she has a pretty serious condition going on in those paw pads. It is such a huge relief that this surgical repair of that paw has gone so well, because at one stage it was looking like we may need to amputate that pad, or in worst case scenario, her limb. So this is really a huge relief. We'll just have to keep an eye on that. You just have to keep on soft surfaces, my darling. Hey? Let's have a look also to see how these paw pads are doing, if they've improved at all. No, so it's still very soft. As far as Marley's pillow foot condition, they're unlikely to ever go back to normal. So the goal is to use medical treatment and management to get as much improvement as we can over time. Yeah, so it's just going to be about monitoring now and keeping those paws on soft surfaces and avoiding jumping from heights and trotting on sharp objects and all those sorts of fun things around the house. So how are you feeling? You relieved?
Yes, lots of relief. Yeah.
I bet. Well, it's just been an incredible result, and I am equally as relieved.
Yeah, I bet you are.
I know, the darling. She's just so sweet. We'll just keep an eye on those paws and hopefully no more injuries.
Fingers crossed?
Yeah.
Paws crossed?
Yes, paws crossed, darling. Okay.
Keep going. You got to hold it out. Hold it out. Hold it out. Hold it out.
I'm holding.
Hold it out.
I'm holding.
At Aussie Ark, Kate's first close-up encounter with Tassie Devils isn't quite going to plan.
Let him on. Let him on. Kate doesn't have that food out in front of her. She's pulled it into her feet, which means she's got 10 devils around her legs. They want the food, but they will bite her leg.
This is hard. Where's the steak?
Okay, pass that to me.
Yeah.
Just jump behind me for a sec there.
Yep. All I remember was Tim saving the day. He grabs that meat off me, puts it on the spoke, and I hightail it out of there.
Woo. How are you going?
That was fun.
I told you it would be fun. That's the fun part. So we'll let him settle for a minute.
Yep.
And then we'll grab Moose.
Look at this guy's teeth. Yep. Absolutely enormous.
They've one of the strongest jaw pressures, pound for pound, on earth, and for crushing bone. So I'm going to grab him now.
Yep.
Oh, there he goes. Once he gets on. Okay, you right?
Yep.
Come here, Moose.
Hey, Moosey. How are you, buddy?
He's not right. No, he's not happy. You got a bag there, Max? 1, 2, 3.
Hopefully Moose will calm down once he's inside the safety of the dark bag. Then it will be easier for Kate to check out his wounds.
Yeah, he's really been fighting with the other devils quite a lot. He's got a really big laceration to that lip. If a dog or a cat had this kind of wound, then we would be thinking that this was serious. But not overly worried about these wounds on his face.
Pretty superficial.
For a devil.
For a devil.
Now, let's have a look at this tail injury. It's not only just gone through that skin, but it's also gone through all of that muscle layer and really quite deep. I'm just going to give this wound a really good flush.
He doesn't like it.
He doesn't love it. Just clean that out a little bit.
Whilst Kate is doing her vet checks, Moose goes to the toilet. That's okay, it happens all the time. But after a couple of minutes, I noticed that there's a little white thing wiggling out of the feces. Is it a worm?
Yeah, it's a worm. That would go a long way to explaining why he's losing weight.
Worms are a problem for devils just like they are other animals. They get into the gut and they consume all the goodness that would otherwise be absorbed by the devil.
So we've got a few factors going on here. So we know he's got worms. He's got all of these lacerations all over him, probably resulting on the fact that he's being a little bit picked on.
Yeah.
And maybe he's being picked on because he's actually starting to lose weight and he's become the smallest. So we're just going to put some all-wormer on his back here. And we're doing that just to cover him off against tapeworms and hookworms and roundworms and all those things that could potentially be causing him to lose weight. And let's also give him a shot of antibiotics. There you go, mate.
Done.
Poor little Moose is in pretty bad shape. He's little, he's skinny, he's in poor body condition.
There you go.
Good boy, Moose. But we can't right now just put him back in with the other guys. They are going to make mincemeat of him. He's got to go into a protected little sanctuary by himself. Keep a really good eye on him the next couple of days.
Yeah.
Keep an eye on that wound.
Yep.
Feed him up.
Yep.
Get him back to his fighting weight.
Yeah. Well, he's happy. Thank you for coming up today.
Thanks for having me.
It's a long way, but it's always worth having a vet visit the Ark. It's great. All the animals are sorted and I hope we don't have to see you again too soon.
You know where to find me.
Yeah. Thank you.
What do you have there?
Look at this little guy.
Oh, wow.
He's beautiful, hey?
At the emergency hospital on the Gold Coast, an unusual little patient has just been brought in to Alex and Gerardo.
Poor guy. Chap found him caught in the barbed wire fence. He managed to cut him out, but he's actually still got some of the barbed wire.
Oh, okay, whereabouts?
Yeah, I'll show you. You see that?
Wow.
Yeah. So he's actually got it twisted around.
Oh, you reckon this is webbing?
Yep. Sugar gliders and fences, they just don't mix. Unfortunately, it's something we see pretty regularly. These little guys are native to this area, and around the farming land in particular, there's barbed wire fencing. They're gliding along and they have a run-in with the fence, and it's just a really nasty situation for them, and often they'll die. This guy's really lucky the Good Samaritan found him, managed to cut him free, and he's at least got a chance. We're going to need to
anaesthetize him or something. What are you thinking?
Yep, get him asleep.
Yep.
And then try and remove it, but I don't know how much damage it's actually done to the webbing.
Yeah, that's very fragile.
Yeah. Pop him straight in, I think.
Yeah, whole thing, I think.
That way we don't have to handle him too much before he's asleep.
Alex and Gerardo want to act quickly to minimise stress to the little sugar glider.
This is an airtight sealed chamber where we can put anaesthetic gas in, and it means that we can slowly anaesthetise him without the stress of us trying to handle him. If we touch him too much or stress him out, they can die. Sealed. Once he is out of his cage and under an anaesthetic, then we can carefully assess the webbing and see if we can untangle the barbed wire from his webbing. Are you ready? 1, 2...
Hey, little guy. Oh, he's nicely asleep.
And they can wake up pretty quick.
Yeah.
His arms.
Poor little guy.
Gotta let go, mate. You gotta let go. His claws are so good
He's
at
just
holding on.
I think his instinct is just to hold on. So we're going to have to pry them off without trying to not do any damage. That wire's really clear there now. It's just right underneath him. You got him? There we go.
Got him.
Okay, just straight on there. I'll look after the anaesthetic side of things.
Okay.
We generally don't have masks that are small enough for this little guy, so we just fashion something that's going to work. All we need to do is create a seal, so the anaesthetic, he breathes that in directly, but doesn't kind of go out into the room.
Oh.
No, that's not good. Just, how are we going to get that off? It's literally wound around the webbing, so we're going to have to figure out which way it's wound around and try to untwist it without doing more damage.
Oh, that's fully entwined.
Yeah. Poor guy.
In Sydney, it's a big day for young motorcycle accident victim Chaz.
Look, Chaz, there's your wheelchair. Let's try it out.
Audrey and Alison have been working with animal rehabilitation therapist Reese to help get Chaz mobile again.
He might not ever be back to full function on his back feet, but at least we're giving him the best chance. We're doing the surgery and having rehab here at Animal Rehab Clinic and the acupuncture and hydrotherapy. That's going to give him the best chance to regain that muscle and function on that back legs.
So we're going to turn him around and get him to
back into that.
Sort of back into that, or almost forwards. And then you can click that in.
It's all new for the brave 1-year-old, so Audrey gives some reassuring cuddles to help him relax.
What we've got for him at the back here, there's these nifty little devices, and then we can use this to adjust the height, so we can lift his legs up nice and high as well. There you are, buddy.
Oh, look at him, look at it. Check it
You
out.
look cool.
At first, Chaz isn't too sure,
Oh wow, he's like fully off there.
but he quickly gets the hang of his flashy new wheels.
So Chaz is now fitted with his cool wheelchair. He looks great. He's loving it.
Amazing.
It is amazing. I've never seen this before. I think this is amazing.
Good work, buddy.
We can't wait to get him out to the waiting room because we've got a bit of a surprise for him.
Yay, who's it? Hello! Hi, Chaz! Hello!
So we bring Chaz around the corner and there waiting for him is his entire family. We've got Stella, which is his wife, and his 2 new gorgeous 7-week-old pups who he's never met before.
Good look at you, Chaz. Hello. Hello.
For owner Anita, it's a dream come true after generous donors opened up their hearts to her special little boy.
Both my kids and my son's girlfriend organised the GoFundMe page. It's just so much support and love and kindness from a lot of people, and it's been really, really great. So we're very grateful.
Chaz, you ready to go?
Ready to go with your new wheels.
Bye.
All right, let's go.
See you later. Bye. Bye, puppies. See you in a few days.
Oh, no, I don't
Oh, you don't want to go?
want to go. See ya.
See ya.
Okay, I'm just going to try and work out which way it's winding around because and that's actually helping to have that little bit of fluid. So if you just add, yeah, that's good.
Alex and Gerardo have started the delicate procedure to try to remove barbed wire tangled around a little sugar glider's webbing.
I almost have to unimpale it from the end of that spike there.
Yeah.
I think we really just got to see.
Is that another barb just there? Maybe we feed it off this. There we go. I think we just got to pull it off.
Yeah, got it.
There
Good job.
we go. When they jump from a tree, they can glide for up to 50 metres. So if there is too much trauma to one side, he might be off balance. He may not be able to fly ever again.
It's not going to be how it was,
Yeah.
but there's enough webbing there that I think he's got a good chance of being able to glide. I mean, it's bruised, but we can't say for sure, so we really just have to give him some time.
We don't know how long he's been stuck there for. He may have been stuck on the barbed wire fence for days. He feels a bit thin, so we give some fluids that'll help rehydrate him.
From here, he'll go to the wildlife hospital, and over the next couple of days, they'll see how much of that webbing is viable, and then it's really whether there's a chance of him going back into the wild or whether he'll need to stay at the wildlife sanctuary for good.
So,
What have we got there?
we've got his fluids,
Yep, under the skin.
anti-inflammatory, and this little teeny little thing is this antibiotic.
That's such a tiny dose.
Oh, he's so light, it's only 150 grams.
I'm just feeling that a little bit.
Oh, little matey, it's okay, it's okay. There we go.
Okay, get him into his bed. He's almost awake. So we're just going to pop him in his little bed there. We'll probably put a little bit of heat on just to keep him warm and pop him in the ICU, and they'll keep a good eye on him until the wildlife hospital come pick him up.
Hi, Chazzy.
It's been 4 weeks since motorcycle accident victim Chaz was fitted with his new wheels, and Audrey is excited to catch up with owner Anita to check on his recovery.
We're doing our own rehab with him at home, exercising him every day, every morning, try and bring him for walks or runs. He's not as mobile as any other dog, but he's doing pretty good.
He looks good. How's he settling into his wheelchair?
Loves it.
Loves it?
Yeah, he's comfortable.
And he loves his
wants
little
to go.
goodies?
Yeah.
It's been 4 weeks since I've seen Chaz and I'm so surprised with his improvement. He looks so happy, he's full of energy, he's not even worried about the wheelchair on his back. And I can see there he's moving his back legs on his own, which is great. I mean, he seems to know that they're there, and even when we're just tickling the back of his feet, there he goes kicking away. That's a huge improvement from when we saw him last time.
Yeah,
Huge.
every day he's improving.
Yeah. I'm actually quite surprised with Chaz's recovery. He's recovering a lot faster than I thought he would. He's getting feeling back in that leg and he's moving it on his own. That's quite a significant improvement in such a short time frame. You want to go for a run? Ready?
Ready?
Go! Dogs are amazing. They'll always surprise you.
Good boy.
Bring it back. Sometimes they'll go through the biggest surgeries and they're just happy. They're just happy to be able to walk, run, play, and you can see that all over Chaz's face today.
Ready?
Go! It is slightly toe touching on that left, so that's why he's moving it as if he's using it. So you can probably drop that right one down a bit.
Yeah. Good boy. You're bringing it back for a change.
I know. It's always hard to say how these dogs are going to go. It's such a big surgery and such a major injury. Obviously, we want him back to walking completely normally, but even if he's just walking, I'd be happy with that. He's come so far, week by week, the progress has been amazing. So, very hopeful.
He's happy though, isn't he? Like you can see his spirit.
You wouldn't even, It's just so nice to see him happy. Oh, hello, aren't you gorgeous?
As for Marley, her badly lacerated paw has healed well. Feline AIDS is currently not affecting her, but Danni will keep a close eye on the special little girl into the future. The traumatised sugar glider that was tangled in barbed wire, fully recovered, has been returned to the wild.
It's all right, mate. You'll feel better soon.
And it seems nothing can hold back adventurous Zeus. The rescued greyhound's shattered leg has healed well. He's looking forward to gentle walks in the park as he continues to recover.
Good boy, mate.